The Dental Care Profile Report is DHSV's replacement of the original Titanium report of the same name. This report is used to provide information about the types of services provided by individual clinicians and the agency overall. It is important to note that the Dental Care Profile Report is not a report to measure total output. Rather, the Dental Care Profile is a measure of the number of services provided per 100 individuals treated. The services or treatment items are grouped together into categories so that you can get a profile as to the rates of how many of a particular type of service each clinician provides for every 100 individuals they treat. DHSV provides dental care profile reports for region and state on the extranet so that you can compare your overall agency's profile with the overall averages for other agencies. The Dental Care Profile Report is accessible under the Productivity Reports group of the Titanium Reports menu, as shown here. Displayed here are the available filters for running the Dental Care Profile Report. Your agency's password code needs to be entered into the agency code field, as described in the report's overview video. The start and end date defines the reporting period, where the report generated will calculate the dental care profile measure for treatments completed and individuals seen within that date range. A clinic filter is included if wanting to assess the dental care profile separately for each clinic under your own agency. A sample of the Dental Care Profile Report is displayed here. The profile data is displayed for each individual provider in separate rows, with an overall agency or clinic profile for all providers at the base of the report. The columns in the main body of the report provide a measure of the number of service items provided for every 100 individuals treated in the report period by the clinician, emphasising the numbers do not represent the total number of services the clinician has provided, but rather a rate per 100 individuals seen. The interest in the Dental Care Profile Report is to compare the differences between individual providers, particularly for elective procedures under the Diagnostic and Preventive group. If by way of example Clinician B has provided a much higher figure than Clinician A, this does not mean that Clinician B is doing too many of the items or Clinician A is not doing enough. It merely highlights there as a difference that either clinician not be aware of and becomes a point of discussion as to what situations those services are provided. With the groupings under each column of the report, the Titanium User Manual has a table listing what items are under each group. So if you're wondering which items are under other preventive, for instance, you can find that out through the Dental Care Profile Report section that is in Section 8 of the User Manual. That table in the User Manual shows only valid numeric service items that are included in the calculation of the Dental Care Profile measure, and those service items include the 3-digit state-funded codes as well as the 5-digit 88 Child Dental Benefit Item codes. The left columns of the report display the total output for each clinician, including the number of individuals treated, number of courses of care, visits and treatments. When viewing the report, only profile for those clinicians with a reasonable output should be assessed. A profile for a clinician based on 3 or 4 individuals treated would clearly not be representative of the types of services provided by that clinician, so that row of data in the report would be ignored. Also be mindful that private providers that have provided treatment under vouchers will also be listed in the Dental Care Profile Report, although usually their output of individuals' courses of care and visits will be relatively small. The Dental Care Profile Report is a useful report for a senior clinician to generate, and if exported to Excel, can be manipulated to provide the profile figures as feedback to clinicians with comparisons of the overall clinic or agency profile. When generating the profile report, we recommend it be run for a full 12-month period. To run for shorter periods can produce skewed profile numbers, as it is being calculated from a smaller base of output.